If your doctor wears a white coat, this is one report that you must see. The doctor that you go to, is he actually infecting you rather than curing you? Is your doctor adding to your disease? And is that white coat that you've come to trust as a mark of a true professional, should it really be setting off an alarm bell in your mind? A Mangaluru-based doctor wants to ban white coats because he says the white coats facilitate transmission of infection. Dr. Edmond says doctors and medical students in India should stop wearing the white coat because they harbor potential contaminants and contribute to spreading infection in hospitals. Dr. Fernandez's views have been published in a British medical journal. Dr. Fernandez now joins me on the broadcast. Doctor, you say doctors and medical students in India should stop wearing white coats. You say that the long sleeves lead to infection being spread. This should be avoided. Do you have proof that this happens?
Yes, absolutely. There's enough and more evidence done in India and abroad where it's proven, strengthened facts that hospital-acquired infections does more harm than healing, and white coats is one of the factors that lead to nosocomial infections, which in turn delays the healing aspect of every patient coming into the hospital and those of them who are suffering from it. In the United Kingdom in 2007, there was a landmark decision taken to ban white coats, long sleeves, and enlightened politicians, statesmen of our country should act on this.
So it's not the color white, it's just a long sleeve coat that needs to be avoided. What if it goes through a disinfectant? If it's disinfected, does that help? You know, for the laymen who go to a hospital, tell us, where is the problem? What's the solution?
See, in technical terms, these are called nosocomial infections, which are also known in other words as hospital-acquired infection. It's nothing new to the medical community. It's just that since 1947, we've been comfortable about it. We've not done anything. It's that time of the day when we need to be a little alert. By 2025, India would be the diabetic capital of the world. By 2030, we would be leading in road traffic injuries. 194 million children go malnourished. And when these kind of population, this base is exposed to hospital-acquired infection, I'm worried. Everybody should be worried.
Well, this certainly appears to be a cause for concern, but is this a problem restricted to India, or is it a threat world over?
I'm sure there would be a threat of this hospital-acquired infections all around the world. And that's why if you see prior to 2007, the United Kingdom had a great amount of infection that was spreading across. After this landmark decision, when they decided to ban wristwatches and be bare below the elbows, the incidence of this drastically decreased. And okay. India being a middle income country with limited resources, pro-poor healthcare systems, and our public health in crisis, okay, I think it's time we give it the appropriate attention it deserves.
Okay. Yeah. Now, I was going through your report, Doctor. You've also been quoted as saying, given India's tropical climate, it's common sense that we should discourage wearing long sleeve clothes or white coats because you feel they're not washed very often, perhaps once every few weeks. So are you saying white coats are actually not sterilized? They're a den of virus and bacteria and extremely dangerous in hospitals?
Bacteria.
Absolutely. I mean, more than 80% of the doctors and medical students do not wash their white coats, not even once in a week or once in 2 weeks. It's there for months together. You put it on your chair, you put it in your room, and you just pick it up, go for rounds. You wear it when you visit communities, and then you come and dump it back again. Who are we trying to lie? Who are we trying to cheat? Can we do something to save the people of our country?
Okay, so perhaps half sleeves is what you're recommending, and patients who go to doctors who wear long sleeves, now there is fear of secondary diseases, problems that they could acquire in the hospital itself.
Yes.
Not necessarily. I mean, infection may be present on different white coats. Not necessarily all doctors do that. But at the same time, this needs to ring an alarm bell. We need to be cautious. Probably bare below the elbow, a bow or a name badge should do well. You don't find patients identifying doctor by which white coat he's wearing, do you? So it's a case in point where you would find a doctor well presentable, well dressed, and then he would go and patient of course knows you then.
Okay, so what you're saying is that doctors should just do away with the white coat. It's not the color white, it's just a long sleeve coat that they should do away with.
Identity.
Who created that identity? Primarily, it was in the recent 18th century where white coat was introduced, and it was compared with the scientists, the laboratory workers, where this idea then came into doctors. Today you have doctors wearing white coat, you have hotel management students and professionals wearing white coat, you have barbers wearing the coat. So how does this become an identity? Let's not compare white coat saying police have a dress, lawyers have a dress. It's a very radical comparison we are making here.
Okay. Dr. Fernandez, for the moment, many thanks for joining me here.